Okay, what's up? This is Dan from bodybuilderinthailand.com. Today's video is about HCG. HCG in bodybuilding, HCG combined with steroid use. This video is for educational and entertainment purposes only. Don't do anything discussed in this video. And this is not advice, and I'm not promoting the use of this substances. I'm just talking about my experiences. So, HCG stands for human chorionic gonadotropin, and what it is you might think, what, you use that in bodybuilding? Isn't that the stuff that it's present in a woman's urine when she's pregnant? Yes, it is. A woman produces it when she's pregnant, and that's actually what is what triggers the pregnancy test when they piss on the pregnancy test and it tells them if they're pregnant or not. It's because of the presence of HCG. What does this have to do with bodybuilding? Well, HCG is an analog for luteinizing hormone. And what that means, an analog, is it means it stimulates the same receptor. So it's a chemical that is very similar, and it does the same thing. It's not the exact same chemical as luteinizing hormone, but it's very similar and it does the same thing in the body. So what that is important for is because if you remember, what makes your testicles produce testosterone? Well, the pituitary gland releases luteinizing hormone, and that stimulates the Leydig cells in the testicles to produce sperm and testosterone. So because of the fact that we can use HCG, which means that you can do a steroid cycle and not shut your own balls down. You can still be producing your own testosterone at 100% during your steroid cycle if you stimulate your testicles by injecting yourself with HCG. It's also, what I use it for is I use it to wake my balls up from time to time. Because I usually don't use it, but I use it when I feel like it. I use it when I feel like I want to use it. And so what that means is that probably once every 3 months or so maybe 4 times a year, I will, for a month, so maybe only 3 times a year, for a month I'll use a vial of HCG, and usually a vial is 5,000 IUs. And what I'll do is I'll shoot usually intramuscular. I'll just mix it with my testosterone oil shot, and what I'll do is I will put 500 units, 500 IU twice per week. So I'll inject that, or maybe I'll do it 3 times per week, 500 IU. So it'd be either Monday, Thursday, or Monday, Wednesday, Friday. And what that'll do is it will make, like I said, my balls during while I'm using testosterone they're smaller than when I'm not. They're not raisins, but they're about 75 to 80% their normal size. 70 to 80% their normal size. So when I use HCG, they go back to their full size, and this is while I'm using testosterone. It wakes them up, they start producing testosterone again, they start producing sperm again, and they go back to their normal full 100% size while I'm on cycle. So some guys, they're worried about their fertility or something, or they're worried about having their balls shrink or something. And this would be a way that you could avoid that. If you inject HCG, you're fertile. So, and you will also have full testicles. So, an interesting thing also is that when you're using anabolic steroids and your ability, because it does to some extent stop your sperm production as well as your testosterone production. And when you're using them, it changes the texture and the amount of your semen. So when you come, a lot of times it will be like more thick, and less overall will come out. It'll be less like watery, and less will come out. And when you use HCG, it reverses that as well, so that it's the same as when you're not using testosterone. If you use testosterone, guys, I mean, there are side effects, you know, and so if you want to do steroids, there are side effects, and this is one of the things that I'm saying, and that's why I'm just telling you guys this stuff, and it's kind of like stuff that normally people don't really talk about, is because it's just a matter of whether you care or not. So this is one of the kind of weird side effects, is that when you come, less comes out, and it's thicker. So when you use HCG, it makes that go back to normal, bigger loads, and they're more wet, like they're supposed to be, instead of thick and white. And it also turns on your body's natural hormone production again. So you're making testosterone. If before I come off, because I come off for like about like 5 or 6 weeks, 2 or 3 times a year, I just stop taking everything. I'll usually run HCG right before I do that, because it turns my balls back on, so that then when I am done, injecting steroids, then my balls are already back to normal size, because they already did that by taking the HCG while I was using the gear. And then I just stop injecting everything, and they're already, it's kind of like kickstarting them. It just makes it a little smoother when I come off. So that's why people use HCG. Alright, visit bodybuilderinthailand.com to learn the truth in bodybuilding.